What's up everybody, Dr. Rossi, and we're going to continue our discussion here on postpartum depression. Specifically, we're going to talk about the treatment of postpartum depression. Now, these are exciting times for postpartum depression because just recently the FDA approved the first oral medication for postpartum depression. And this is a really big deal. This medication I've talked about in the past. It is called Zuranolone, and it is a very important step forward. And I'm going to tell you why in a second. So we know that postpartum depression can be a very serious and dangerous illness that can cause risk to both the mother and, of course, the newborn infant. And prior to that, the only treatment that we had for postpartum depression was a 60-hour infusion that had to be carefully monitored in the hospital and was only available at certain designated centers. And this medication was known as brexanolone, so very similar to zuranolone, and it carried the premium price tag of $34,000 for this 60-hour infusion. So zuranolone uses the same mechanism of action and offers the medication in a convenient pill form. So let's learn more about how this medication works and whether or not we should really be excited about it as a treatment for postpartum depression. Let's talk about how zuranolone actually works. Like, how does this treat anxiety and depression? So if you're not into neuroscience and you're not into technical details, I suggest you just go right past this part or plug your ears up, whatever you want to do, because it's going to get a little technical here. So zuranolone, like I said, is an orally active neurosteroid that is going to act as an allosteric modulator of the GABA-A receptors. Now that's saying a lot here and it might be very complicated, but this is what I want you to kind of take away from that statement. This medication is going to work at GABA-A receptors, and we want to remember that GABA is the major inhibitory neurotransmitter. So it's going to have some effect on treating overactivity of a particular area. And that's what we're going to talk about next here. So after childbirth, a consistent finding that we find in all females, all women who are postpartum, is that the endogenous, meaning in the body, natural neurosteroid, allopurinol, decreases substantially. So there's a substantial drop in allopurinol for all people postpartum. Great. And this then results, this drop in allopurinol is going to result in overactivity of the hypothalamic pituitary adrenal axis, or HPA axis for short, which is going to result in, of course, anxiety and depression. So like I said, GABA is an inhibitory neurotransmitter. If our GABA neurons are not functioning properly due to this reduction in this essential neurosteroid that's going to be modulating GABA-A receptors, then we're going to have the potential for developing anxiety and depression. Of course, not everybody will develop it, but this is the neuroscience behind it. Now, zuranolone, this orally active neurosteroid, is going to act as the allosteric modulator for these GABA-A receptors. It's going to essentially do what the allopurinol was supposed to do that has been reduced secondary to the postpartum period. So it's going to increase the binding of GABA to these receptors, resulting in an overall inhibitory effect. Zuranolone's dosing and FDA approvals. So currently zuranolone is only FDA approved for the treatment of postpartum depression. However, we are going to see other indications in the near future, such as major depressive disorder, which research is already underway on. Now, what makes this medication very interesting is its rapid onset of action, so it works rapidly, and the short duration of treatment. So this is two things that aren't very common in psychiatry: have rapid onset of action as well as a short time-limited duration of treatment. So zuranolone will be taken once daily, usually at a dose of 50 milligrams, 50 milligrams, over a course of 14 days. The half-life of the medication is 16 to 23 hours, making it appropriate for once daily dosing. So this is a very nice treatment in the sense that you can do it over the course of 14 days and it only requires you to take the medication 1 time per day. So no discussion of a new medication would be complete without talking about potential adverse effects. And there's one that's very important because the FDA has a warning label on the medication for this purpose, and that is to avoid driving or operating heavy machinery for 12 hours after taking the medication. Now, this can have a significant impact on people's lives because, of course, people have to work, they have to make money, they have to feed their families, and if you can't drive your car for 12 hours after taking the medication, that's a significant concern. So thank God this is a time-limited treatment for postpartum depression. It's only going to last over the course of 14 days. Now, the most common side effects, the things that we see pop up all the time with this medication, is things like drowsiness, fatigue, dizziness, diarrhea. And the two that were a little strange to me but are seemingly occurring more often with this medication are nasopharyngitis, also known as the common cold, and urinary tract infections. We also want to warn our patients that there is increased risk of suicidal thoughts and behavior when taking this medication, kind of a standard box or label warning that is on all antidepressant type medications. Now, of course, guys, I have to talk to you about the FDA approval and efficacy of this medication, and I had to do some digging on this one to give you guys the goods here. The FDA approved this medication based off of 2 randomized placebo-controlled trials of the treatment of adult patients, adult women, who met criteria for major depressive disorder and whose symptoms began either in the 3rd trimester or within 4 weeks of delivery. Now, the first study used 50 milligrams of zuranolone as the active treatment and compared that to placebo for 14 days. The second study, patients received 50 milligrams of zuranolone or 40 milligrams of zuranolone or placebo, and they compared these 3 groups for over that 14-day course. Now, the patients were not only monitored for 14 days, they were also followed up for 4 weeks after the treatment. The end point was the reduction in HAM-D17 scores at day 15. So the primary endpoint was a reduction in HAM-D17 scores at day 15. Now, we have to keep in mind that these studies were funded by Sage Therapeutics and Biogen, the companies that manufacture zuranolone. So these are what we would call industry-sponsored studies, which doesn't necessarily make them bad studies. It just means that they're going to do a lot of things to try to make this medication look really good because they're trying to gain FDA approval and bring the medication to market. So we have to keep that in mind. Now, I'm a big believer that when you're looking to determine how effective a medication is compared to placebo, you want to comb through those studies to find what we call the effect size. Now, just to kind of remind you guys, effect sizes can be grouped depending on the number. So I would say anything that's like 0.2 to 0.3 is considered a small effect size, 0.5 to maybe 0.8 is a moderate effect size, and then things that are like 0.9 or better are large effect sizes. So I was able to find this in the supplemental data on these studies, and ultimately the effect size at day 15 was 0.52, which would place that in the small to moderate region, or small to moderate range rather, in terms of effect size. So this is not a huge effect size is the bottom line. Like, we would really like to see, again, like a 0.8, 0.9 or better to indicate that this is really super effective for the treatment of postpartum depression. And at day 45, so remember I said they followed these individuals out for additional weeks, an additional 4 weeks after the treatment was completed, and the effect size actually drops to 0.33, which is similar to the effect size of antidepressants in the treatment of major depression. We generally think of those as like a 0.3 effect size. So there is some fall off as well after the initial 14-day treatment when you follow individuals out for 45 days. Alright guys, so let's try to wrap things up here in a little conclusion on zuranolone, the newest medication FDA approved for the treatment of postpartum depression. Now, as I said before, it's exciting in the sense that we don't have many treatments for postpartum depression. Prior to that, all we had was a 60-hour infusion, brexanolone, that was only available at specialized centers and commanded a premium price of $34,000. It was inconvenient, it was expensive, etc. Now we have an orally active medication that is probably still going to be very expensive. So that's one of my gripes here, I guess, about this. It's going to cost a lot of money to receive this treatment, but it's rapid onset, it's short duration of treatment, 14 days in total. And what we can kind of take away from this ultimately is Is the medication worth paying the premium price for? Does it provide enough efficacy for us to pay a substantial amount of money for it? Now, like I said, when I looked at the effect sizes, I'm not that impressed. A 0.52 is a small to moderate effect size, again, costing a substantial amount of money. And we also noticed that at 45 days, that effect size actually drops to 0.33. So there's a reduction in the efficacy of this treatment as time goes on and as the person extends further out from the 14-day treatment. So I'm still on the fence. I think it's good. I think it's somewhat exciting. I think it's, again, a novel mechanism, an interesting mechanism, being an allosteric modulator of GABA A receptors, but I'm not so convinced that this is going to be a disease modifying or game-changing medication. But like we talked about in postpartum depression, most cases resolve with treatment, so maybe this is like a really good niche for this medication because it's time limited, rapid acting, and it gives the person some time to get into psychotherapy and to get other things in place to help with the postpartum depression. So I'm going to hold the video there, guys. If you have questions or comments, I would love to see them below. And if you haven't done so already, please consider liking the video and subscribing to the channel. It really helps me to keep this thing going. So thanks again for watching. See you in the next one.